Dr. G. Manjula, one of the most prominent and notable embryologists. Dr. Manjula has more than 25 years of experience in ART, which includes overseas exposure too. She is an assistant professor of clinical embryology, Department of Reproductive Medicine and Surgery at Sri Ramachandra Institute of Higher Education and Research, Chennai. She is also a visiting professor for some of the leading medical colleges in Chennai and has published paper and poster presentations in various national and international journals and conferences respectively. Thank you so much, ma'am, for being here with us today. I'd like to introduce you all our next chairperson of the day, one of the most eminent embryologists, Dr. Sasikala Natarajamani, who has an overall experience of 32 years in medical practice with over 22 years of specific work in the IVF field. She is an experienced IVF lab director with a demonstrated history of establishing new IVF units that can deliver high-quality patient outcomes in ART. She is a pioneer in establishing the first formal PG diploma program in clinical embryology in various private and government educational institutions in India. Dr. Sasikala has innovated and patented a unique semen transportation device, TransSperm, and is one of the trendsetters who has immensely contributed towards the upliftment of embryology. Thank you for accepting our invite and being here today, ma'am. I request you to come onto the stage. I now request the chairpersons to introduce the first speaker.
Let's start with Dr. Sowbarnika, Faculty and Course Coordinator, MSc Clinical Embryology, Chettinad Medical College, Member of Doctoral Committee, Special Invitee in Board of Studies, CARE, Member of Technical Advisory Committee, National Health Mission, Government of Tamil Nadu, Joint Secretary and Treasurer, International Fertility Research Foundation, Faculty, MCH Reproductive Medicine and Surgery, NEET Entrance Coaching, Speed Institute, since 2019, Assistant Editor, Chettinad Health City Medical Journal, first prize plight of orphaned embryos in Asia Pacific Division of International Conference on Bioethics, first prize quiz competition by Academy of Clinical Embryology 2022, published articles in national and international journals, certified in laboratory animal management and handling by Tamil Nadu Veterinary University. I welcome Dr. Sowbarnika.
Thank you, ma'am. Thanks for the introduction. Good morning, everyone. I'm Dr. Sowbarnika. So I'll be talking on how to ensure precision in the IVF laboratory by implementing quality control and quality assurance. The performance of embryology laboratory is of imperative importance for the successful outcome of ART procedures. We all are aware of it. So how do we implement it? Specific condition maintenance is essential for optimal embryogenesis and clinical outcome. In order to ensure and maintain these very specific conditions, quality control routines should be established with quality specifications for each quality parameter. So these are to be checked on a periodical basis, and to ensure whether the specifications are met, necessary fine-tuning can be done to bring the levels to acceptable levels. Coming to the quality management system. So this quality management system describes the entire system developed by an organization involving establishment of quality policy, quality objectives, and also the process to achieve these objectives and policies. ISO definition is the coordinated activities to direct and control an organization with regard to the quality. So quality management is a very large concept. This encompasses both quality control and quality assurance. The interplay between quality control, quality assurance, and good laboratory practice within ART laboratory is very essential for us to maintain and achieve this proper quality management system. Coming to quality cycle, this is a tool that helps us to implement the quality management system. So quality cycle is otherwise known as Deming's cycle. It is simple and commonly used one, a quality implementation methodology that encompasses also continuous quality improvement programs. It enables both management and execution, measurement of the performance of the system in use, and the targets where improvements can potentially be made. So what are all the components or the constituents of this cycle? It is plan, do, check and act. Plan, where the SOPs are developed. Do, it is the implementation process, check, where the outcome can be periodically measured and analyzed, and act. If a positive outcome is seen, it can be implemented. If there is any negative outcome, then we have to identify opportunities and reassess the SOPs that we have formulated. Quality control, it is the establishment of quality specifications for each quality characteristics, assessment of procedures used to determine conformance to these specifications, and taking any necessary corrective actions to bring them into conformance. The main objective, the foremost and main objective of quality control is to ensure that the lab processes and the outcome meet the quality standards, like monitoring the performances of the equipments, handling samples, and etc. When newer techniques and methodologies are introduced in the laboratory, quality control is important to reassure and assess there is no delineation from the normal processes. These include staff, equipment, culture media, consumables, and everything that is involved in embryo culture. So before getting into the SOPs, standard operating procedures, we'll know about the policy triangle. So this policy triangle framework, it has 3 P's, the components. One is policy, process, and the procedures. So this process mapping is the documentation of creating a flowchart or concept map of the various processes required to achieve a quality objective. A single quality policy contains a lot of processes, and each and every process is again going to have a lot of procedures in it. So what is the difference between a process and a procedure? Process is what we do, and the procedure is how do we do it. So this process mapping, it is going to enable us a transparent workflow which will help us to easily train all the personnel involved in the execution. This leads us to write the various procedures involved in making the process happen. So these set of procedures are called the standard operating protocols, SOPs. So SOP documentation is the final step in making a lab manual, and it defines the plan phase of a quality cycle. Coming to the other component of quality management system, QA, quality assurance. So it mainly focuses on maintaining the high quality benchmarks established by the QC methods. Key components of quality assurance includes implementing the standard operating procedures, conducting audits, both internal and external, and regular evaluation of laboratory procedures to identify areas or identify scope for improvement. Key performance indicators. This is yet another tool that ensures the implemented quality control, the SOPs, everything is properly functioning. So as per the ISO definition, in the setting of a clinical laboratory, quality indicators are necessary for systematically monitoring and evaluating the laboratory contribution to patient care, and they present an important element within the quality management system. So to ensure the integration between quality control, quality assurance, and good laboratory practice, it is essential to have a defined goal and measurable standards for evaluating the performances. By monitoring and assessing KPIs, ART lab can pinpoint any issue and take necessary action to improvise or make actions that can effectively improvise the outcome. The KPIs should be objective, relevant, regularly checked, discussed, and communicated to all the personnel in the laboratory. KPIs can be designed based on either a group of population with positive prognosis, or as well it can have the entire population. But appropriate statistical methods has to be implemented to just get rid of the patient variation. These KPIs are a part of quality improvement. They provide comprehensive monitoring program to enhance the lab performance and focus on the progressive increase in quality and efficacy. So this expert report termed the Vienna Consensus has developed performance indicators for the ART laboratory procedures. So they say that these indicators deemed essential for evaluating the introduction of a technique or process, establishing minimum standards for proficiency, monitoring ongoing performance with a quality management system, benchmarking, and quality improvement. In general, the result of series of KPI will provide adequate overview for most of the most important steps in the IVF laboratory process. So this is one table from Vienna Consensus where the crucial steps in the processes that the laboratory undergoes have mentioned on the KPIs, and 2 values are mentioned in percentage. One is competency value and the other one is the benchmark value. So competency value is the minimum set value, like any procedure or any technique that has been performed in the laboratory has to definitely meet that benchmark, competency value. If there is any deviation, if there is any reduction from that competency value, definitely quality improvement has to be done. ESHRE also has given guidelines for good practices in IVF laboratories. So the key parameters from it are to ensure competent personnel and defining responsibilities to the personnel in the lab, coining SOPs. Also, it should include management of adverse events, ensure full traceability of gametes and embryos along with record and documentation, to confirm all the media, reagents, disposable. So whatever that we use in the laboratory are appropriately tested using the assays that are meant to be used for them. Ensure proper and periodic equipment maintenance, service, calibration, verify conformance to specifications, taking correct action to keep the procedures that happens in the laboratory under conformity, review the performance and to ensure continuous system or the quality improvement that is always happening in the laboratory, provide risk assessment analysis for all the laboratory activities. So this line diagram, this shows all the variables that a laboratory can have. So the laboratory is influenced by various parameters, but it can be broadly classified into two. One is the laboratory and the other one is the culture system. So how to get rid of all these variables and how an optimum culture and optimum outcome can be achieved. So this is mainly by implementing quality control and quality assurance at two phases. One to the laboratory and other to the culture system. I have brought in some of the significant points here. So the purpose of quality management, how do we actually achieve it? Coming to the laboratory setup, facilities and air quality. The IVF laboratory must have adequate functionalities to minimize any damaging effect on the gametes or the embryos, control temperature and humidity. Materials that are used in the construction should be devoid of VOCs, the volatile organic compounds. And the laboratory has to have facilities like separate washing area, specific cloths that are lint free to be used inside the OTs and the laboratory premises, sticky mats, and especially restricted entry. A laboratory space should always have people with restricted entry. So this again is a clean room, and adequate air quality is achieved by using filters like HEPA. HEPA can filter up to 0.3 particle size of up to 0.3 micrometer. Coming to the personnel, one of the most important parts of the IVF laboratory, the number of laboratory staff should always reflect the number of cycles that are performed per year. Other duties like administration, training, education, all these are to be importance has to be given equally other than the techniques and procedures we perform on a daily basis. Provide an adequate climate to perform all laboratory tasks in a timely manner to ensure patient safety and quality care. Sufficient quality personnel should also be available as backups. So the processes, whatever the techniques and process that happens in the laboratory should be only based on SOPs, and we also should make sure that all the embryologists, all the personnel inside the laboratory who performs the procedures should follow the SOPs to prevent differences in the outcome. And these SOPs, like I mentioned, have to be reviewed periodically. Coming to the equipments, the laboratory should contain all essential equipments, items required for IVF in a number appropriate to the workload. Recently, we have our ART guidelines that has a list of equipments that is required for level 1 and level 2 ART clinics. So these equipments are to be calibrated. Working conditions should be ensured. Periodic maintenance is essential. When there is downtime for any equipment, it has to be documented and notified to the other personnel working in the laboratory. And considering the wear and tear of equipments, time appropriate replacement is very crucial. Consumables and disposables, they are to be tested for toxicity, the endotoxins, subjecting them to MEA, mouse embryo assay or LAL test. Ensure delivery is happening in an appropriate condition. For example, when we procure culture media, the cold chain maintenance has to be ensured. Ensure proper storage and proper handling by us to prevent contamination. And always have an eye on the date of expiry, because any media or consumable beyond its expiry date should never be used. Cultures, coming to the culture system. So the major components that can affect a culture system is temperature, pH and the gas levels. So optimum embryo culture is important in achieving a better ART outcome. So the set temperature is 37 degrees Celsius. So wherever the gametes or the embryos that we are going to handle in vitro, the surfaces are going to be 37 degrees Celsius. So the temperature has to be checked and monitored on a daily basis, and periodic calibration of the equipments are essential. So here I've brought in one study where the embryos were cultured at 36 degrees Celsius and 37 degrees Celsius, transferred, and looked for the live birth rates. So it is very definite to see that the pregnancy rates are higher, the live birth rates are higher when the embryos are cultured at 37 degrees Celsius. So this 1 degree, I would say, is a very vast change in temperature. 0.2 to 0.4 degree variation in temperature, pH, are even going to affect our culture system. CO2 and O2 levels, it is very essential to check them on a daily basis. It is very essential to monitor the cylinders as well. Do not always believe with what the display says. We also have to counter check with all the calibrated equipments. pH, it is mandatory to check when a new batch of culture media or a gas cylinder is changed. And how do we overcome all this? Prevent temperature, pH, all fluctuations by having number of adequate incubators in accordance to the caseload we perform. So this is going to limit the opening and closing of incubators, and thereby preventing extremes of fluctuations of temperature and pH. And before subjecting it to culture, the overnight incubation of culture media and the oil that we are going to overlay definitely provides us with optimum pH and temperature to the developing embryos. Despite all our periodic monitoring and checking, when there is unexpected drop in the levels, temperature, pH, whatever, we can rely on these alarms. Now the latest equipments have that can be tagged to our mobile phones. So anywhere we are, we'll be intimated like what is happening in the lab, and immediate action can be taken. Again, checklist, this is very important. The checklists are to be, marking has to be done in our checklist at the start of the day and at the end of the day. These checklists have to have, the checks for every variable that is possible in the laboratory, and ensure optimum range is maintained. So check variables that are not automatically monitored also. For example, the water levels in the incubator, and record and documentation is very, very important. Something to the sample identity and traceability. So this is very important. So how we can overcome this is by providing unique identification code per patient, and it has to come to all the carrier devices or the consumables that we use inside the laboratory. And double witnessing is yet another method to prevent mishaps. The SOPs have to have emergency plans. So emergency plans aims to describe the action to be taken in order of importance. So first comes is the safety of personnel and patient. Next is the protection of all the fresh and cryopreserved human materials in the lab, and limitation of damage to equipment and the medical records. So take home, implementing quality management system gives us or lets us achieve the optimum outcome. SOPs are to be reviewed on a regular basis and identify scope for improvement. Quality control and quality assurance are to be implemented, and their performance can be identified by utilizing key performance indicators and by following good laboratory practice. And to ensure controlled and optimal culture conditions, we always aim at having an optimum result in the IVF laboratory. Thank you. Thank you, FOGCE and AFO, for providing me this chance.
Most interesting and valuable presentation.
It's open for questions now.
May I?
Yes, ma'am, please.
So, what will be the individual KPIs you will check for embryologists?
Right from the number of, the fertilization rate post ICSI, the cleavage rate, the blastocyst formation rate, post-thaw embryo survival rate, retrieval rate, all these things can be checked for an embryologist, ma'am.
Okay. With regards to ICSI, any particular rate you will watch?
The rate of 2PN formation. That will assess the technique, whether the technique is, when the technique goes wrong, there can be a chances for triploidy.
Degeneration?
Yes, very importantly, degeneration. When the cytoplasm is not pierced properly, the degeneration can happen, yes.
Okay, about the incubator load you were saying.
Yes.
So what will be your number? Say for example, you have 100 cases.
Yes.
The number of incubators?
So textbook says not more than 12 culture can happen in one incubator, but
Really?
yes, I saw it in Gardner, but I don't think it is practically possible. So
Okay, and the embryologist load for a number of cases?
number of cases, one embryologist for 150 cases per year is the minimum cutoff. So yes.
Thank you.
Thank you. Thank you.
Any questions from the audience?
So what is the class of ISO for the IVF lab?
Class 7, sir. It doesn't have 0.3 micrometer of size particles. It comes under ISO class 7.
Okay, class 7 you are suggesting.
Yes, sir.
It's a reference is there, anything?
Yes, sir. Many publications are there.
Oh, okay, thank you.
Any more questions? We have many students here. We expect you to ask any questions or any doubt clarification so that it will be very helpful for you people.
She was very clear in her explanation, maybe.
So that nobody has any doubts.
Yeah.
Ma'am, I have one doubt in.
Yes, please.
Ma'am, I have one doubt in IVF cylinder placement.
Yes.
In some centers, they were keeping the cylinders within or like nearby the laboratory.
These cylinders are supposed to be placed outside the embryology
outside
laboratory.
or I mean
Yes.
the same floor, but in some centers they were keeping in the ground floor, which is 2-3 floors away. So which one is recommended and which one is the best?
When the tubing is going to be more, I think the chances of leakage can be more. Ideally the cylinders are to be placed adjacent to the laboratory premises, but outside the laboratory area, because people will come inside and go out to change the cylinders, and cylinders are made of iron, they'll be keep rusting. So to avoid all these things, to prevent contamination, they are kept outside the laboratory premises.
Okay, ma'am. Thank you.